I love State of Reform because it's the time of year when I see all of my partners in the health delivery system, especially my CCO partners and Oregon Health Authority, legislative staff. It's really the best symposium of healthcare policy ideas that Oregon offers.
I think it's interesting to hear from peers about the projects that they're working on, the challenges that they're dealing with.
It's an opportunity to hear about what similar organizations in other states are doing, some of the challenges that they're facing. There's a lot of strategy that goes into that, long-term planning, so being able to get ahead of that is really, I think, important for the organizations.
Building on those lessons of partnership, how to be able to say, hey, we got to slow down for just a second because we didn't get this right.
Working together in public-private partnerships is going to be key in order to make sure that the health-related social needs is actually going to be successful. And the nice thing is that the community-based model is the foundation for us to do that.
So much of this depends on moving at the speed of trust, and those aha moments are what give us the opportunity to transform, make better connections, change where it's not serving the needs of our members.
Given how complex and fast-moving the healthcare environment is, I think it's always helpful for community-based organizations and nonprofits that focus on health and social services are aware of those dynamics and changes.
Technology is moving very quickly right now, and I think people aren't always aware about the innovation and the technology and the reusability of that innovation and technology. So I like the kind of the ability to collaborate collectively to solve complicated problems in healthcare.
Meeting people, renewing friendships, meeting new people, finding out what efforts other people have made and where they succeeded and failed, then you can exchange information.
Partnership has been a theme that I've heard already come up. In one of the sessions, the panelists were learning from the questions that were coming up. So I think the dialogue that's happening already is going to be really helpful.
We have a lot of focus on highly educated shortages, but we also have a huge shortage of all of the people who support them in the work that they do. And so it's exacerbating that burnout.
I think this is one of the conferences that I really appreciate every year because it gets all of us together to talk about real solutions, how to sort of move the needle on some things. And I think it's up to all of us to challenge each other to step up and put our money where our mouth is.